everyone. This is Dr. Sal Napoli. I'm very excited to be here today. We're going to talk about MS. I'm the medical director of the Multiple Sclerosis Center here at the Neurology Center of New England, where we provide comprehensive care, and we want to be a life partner for your condition and be there for you. And today's going to be a first in a series of videos regarding MS. And today I'm going to talk about exactly what MS is all about and what MS is and the etiology of MS. In the future, we'll be talking about other aspects of MS, diagnosis, treatment, symptom management. But today, I just want to go through what MS is all about. And basically, MS is an autoimmune condition of the central nervous system. The central nervous system involves the optic nerves, the brain, and the spinal cord. And the way I like to describe it is it's a friendly fire condition where your immune system acts like a military, so it's the military of your body. And for some reason, the immune system or your military gets confused. You have 100 military members in your body fighting infection, viruses, tumors, and 3 or 4 of those military members out of the 100 members go a little bit rogue and create friendly fire in your own tissue. In this case, it's the central nervous system. So there's friendly fire going on in your own tissue, which causes symptoms. So what happens is this military or the immune system creates inflammation in areas where it shouldn't. And there's other examples of this besides MS, like rheumatoid arthritis, which targets the joints, Crohn's disease, which targets the gut, and other autoimmune conditions involving the skin and other parts of the body. But MS is focused on the central nervous system. So in essence, your immune system works well, it just gets confused. You can fight infections, you can fight tumors, but the only issue is your innate immune system and your adaptive immune system gets a little bit confused and creates friendly fire in your own body. And what happens when this friendly fire occurs is you have symptoms. So when you have inflammation, say of your optic nerve, of your spinal cord, of your brain, you may have symptoms. And these symptoms may involve numbness or tingling of your feet that travels up, like a transverse myelitis. You may have inflammation of your optic nerve, and that may cause blurriness. And some of this inflammation can be silent. So a lot of patients can live a long period of time having silent inflammation without even realizing that it's happening until it hits an eloquent area like the spinal cord or the brainstem or your optic nerve, and then it'll pop up. So in a sense, MS is an autoimmune disease. It's a friendly fire disease which creates inflammation. The beautiful thing about the body is this inflammation does get regulated. There's a regulatory part of your immune system which regulates this overactive part of the immune system, which creates this overactivity. The great news about this condition now is that we're in a period where we are able to control that overactive immune system. We have great monitoring mechanisms to help diagnose patients, to follow patients and treat patients. We have over 20 different medications that help control that overactive, confused immune system so that we can prevent disability over time, we can prevent relapses over time, and keep you stable. There are different forms of MS, and the way I like to describe it is we each have our own individualized condition. It's a fingerprint condition, so to speak, but in general, we stratify the different forms of MS into 4 or 5 different categories. One is relapsing remitting MS, where one has discrete relapses that relapse and remit, and that involves new symptoms that you've never had before, which then can create some level of disability that may recover over time. And in future videos, we'll talk about what a relapse is. There's also, if you sustain multiple relapses over time, then there's a secondary progressive state where one may progress slowly over time, but we hope to prevent that from happening altogether by controlling the relapses up front. There's also a primary progressive MS where one progresses right from the onset, and there's progressive relapsing MS where one may have relapses superimposed on progression. But we're in a state right now where we're very optimistic as it relates to the condition, being able to control things, and here at the Neurology Center of New England, you have a partner for life. Want to thank you for your time. We look forward to having future videos talking about all aspects of MS and other neurologic conditions as well. And we're here as a team to partner with your care, to take care of you, and to be there for you if you have any needs.